The first aircraft with the coronavirus vaccine arrived in Ukraine in February. Starting with several hundred vaccinated per day, Ukraine has reached 13.5 million fully vaccinated citizens today, which is 43% of the adult population. Almost 5,000 Ukrainians have already managed to get 3 jabs. This is a booster dose and an additional dose. The first is needed by those who were vaccinated more than 6 months ago, but an additional dose is received by people with concomitant diseases and lowered immunity.
First of all, there will be people who are threatened simply because of the presence of certain diseases. Those are people who have undergone chemotherapy, people who have diabetes or other endocrine disorders. The second to be administered an additional dose are the elderly.
Ukrainians from the occupied Crimea are also actively immunized at checkpoints on the administrative border with the peninsula and at the vaccination points nearby in Kherson region. To get a jab, they need to have a passport and an identification code if a declaration signed with a doctor is absent.
We have organized a vaccination point here. People can come, conclude an agreement with a doctor, get vaccinated, immediately receive a certificate and move freely around Ukraine.
After vaccination, a certificate is issued. Vaccination data is entered into the electronic medical system. Doctors say someone comes to be vaccinated in order to travel freely and someone because of distrust of the Russian Sputnik V, administered by the occupation authorities in Crimea.
The question is not only about going abroad. If someone has not been vaccinated, that is absolutely necessary to get vaccinated, so as not to get sick and not infect anyone.
3 vaccination points are also working near the contact line in Donetsk region and 3 in Luhansk region. One is not far from the Stanitsa Luhanska checkpoint, the second is in the town itself, and the third is in Melove. All residents of the temporarily uncontrolled territories can get a vaccine there. Among those who came as residents of the territories uncontrolled by the government of Ukraine, 327 people got vaccinated with the first dose, 320 with both doses. A total of 647 vaccinations were made. And if we talk about the Novotroitsk checkpoint, then at vaccination point Olhinka, 29 people got their jabs and 57 more were administered at other points. That is, 90 people were administered vaccines at the checkpoints. Almost 200 billion hryvnias, that is almost $7.5 billion were allocated to finance Ukrainian medicine next year. This is a record budget for the industry. Thus, next year the minimum salary of a doctor will make 20,000 hryvnias, or more than $700. In addition, this year, for the second time, Ukrainian small businesses received assistance in the amount of 8,000 hryvnias. And those who were administered 2 doses were encouraged financially. Each holder of the green certificate was allocated 1,000 hryvnias, which can be obtained via the DIA application of the state services. They say in the Ministry of Digital Transformation of Ukraine that one can spend all the money allocated, even if the remaining sum after all purchases is small. A store can arrange payment of any service or product in parts. The same applies to tickets for transport within the country. They can be paid using e-support reporting the required amount. Starting January, one more function will be added. Ukrainians over 60 will be able to receive an offline card and use it in pharmacies. As for the next year, we have foreseen the possibility to provide services for citizens in offline mode in banks, issue plastic cards after one submits an application to open an account in the appropriate bank. Besides, specialists call a breakthrough the achievements in Ukrainian transplantation this year. More than 300 organ transplantations have been performed. This is twice as much as in 2020. At the beginning of 2021, the Unified State Information System of Transplantation was launched. It ensures impartiality in matching the donor-recipient pairs and therefore provides equality for recipients in obtaining anatomical materials. This worked and brought the results. So far, we consider those results to be intermediate, but the system will be developing. For the first time, the Ukrainian doctors have performed heart transplantation for a child, as well as lung transplantation, and simultaneous transplantation of a heart and kidney. The plans for 2022 are to establish tissue transplantation. The state has allocated almost 1 billion hryvnias for it. Reported by Vadim Kramar, Larissa Zubenko, Yanina Lebedeva and Alyona Hramova, UATV News.